In this video, I'll tell you what to expect when you arrive at the hospital prior to getting your total hip or knee replacement. First of all, you must arrive at the hospital 2 to 3 hours before your time for surgery. You will then be taken to the surgical preoperative area where you will be greeted by specialized nurses who will help prepare you for your safe surgery. They will confirm that your skin is clean and clean you once again. They will also place an IV and go over final paperwork, including the informed consent for your surgery. You will also meet with your anesthesiologist and surgeon to go over the final plan, and your family should stay next to you during this process. Once you are safely prepared for surgery, you'll be brought back to the operating room. Next, let me tell you about the multimodal anesthesia you will get during your total joint replacement. While you are in the preoperative area, you will be given oral medications to help with your intraoperative and postoperative pain. This includes narcotic medications and anti-inflammatories. Your anesthesiologist will also speak with you about a spinal anesthetic, which is generally recommended. This is performed in the operating room and takes 10 to 15 minutes to perform while you are sedated. This helps quite a bit with your postoperative pain control and helps limit blood loss during surgery. While you're in the operating room, you will also have a sedation or twilight anesthetic, such that you do not remember anything during the surgery, but also that helps limit the amount of general anesthesia that you required. Last, local anesthetics are used for both hip and knee replacement surgery to help with your postoperative pain. So again, a multimodal approach is used to help get you safely through surgery and keep you comfortable during your early stages of recovery. Now let's talk about your experience in the operating room when getting a total hip or knee replacement. A total hip or knee replacement takes approximately 1 to 2 hours to perform. However, your time in the operating room is in total about 2 to 3 hours. The reason for this is that time is also required for your anesthesia, for positioning you on the operating table, for placing a urinary catheter, and also for the placement of your final bandages. At this point, you will be moved to the recovery room. In the recovery room, you will be monitored for 1 to 2 hours. Specialized nurses will make sure that your spinal anesthetic is wearing off, that your vital signs are stable, and that your pain is controlled. At this point, you will be brought to the total joint replacement unit for recovery. This is where you will see your family. Remember, from the time you go to the operating room, it's approximately 3 to 5 hours before you will see your family members again. This is on the total joint replacement unit. So in summary, on the day of your surgery, you will need to arrive at the hospital 2 to 3 hours before your time of surgery. You will then be away from your family when you're in the operating room and recovery room, but they will soon see you when you're recovering on the total joint replacement unit.